Hey guys, in this video I'm going to talk about vitamin C, D, E and K. So starting with the vitamin C, also known as ascorbic acid, it is an antioxidant and facilitates the iron absorption by reducing it to ferrous state from ferric state, that is Fe3+, necessary for hydroxylation of proline and lysine in collagen synthesis. That's why vitamin C deficiency will lead to the scurvy, and this is due to this collagen synthesis inhibition. So collagen synthesis won't happen. Why? Because this vitamin C is very necessary for the hydroxylation of proline and lysine. This won't happen. Necessary for dopamine beta hydroxylase converts dopamine to norepinephrine. This reaction is very important, as we learn that there are various factors involved, like vitamin B6, vitamin C, yes. So see, to convert into dopamine to norepinephrine, vitamin C is required. To L-dopa, to dopamine B6 is required. And to convert this phenylalanine tyrosine to L-dopa, BH4 is required. And to norepinephrine to epinephrine. So these two things we have to remember here. Now, so two main thing, we know that it is antioxidant and it helps in iron absorption. These two things will come to you naturally, so don't have to remember this two. But these two enzyme, that hydroxylation of proline and lysine plus beta hydroxylase enzyme, needs this vitamin C to convert dopamine into norepinephrine. Found in fruits and vegetables, pronounced ascorbic. So ancillary treatment for methemoglobinemia by reducing iron. So it is also need in the treatment of methemoglobinuria, because it will convert into again. So this absorption part is helping here convert into Fe2+. So useful in methemoglobinuria. Now the scurvy. So deficiency will lead to scurvy. So this collagen won't be formed. So bleeding is happening everywhere. Swollen gums, easy bruising, petechiae, hemarthrosis, and all this bleeding will lead to anemia, poor wound healing, perifollicular and subperiosteal hemorrhages, and corkscrew hair will be there. Because collagen is necessary for skin, for blood vessel, for hair. So skin will be like poor wound healing, hair will be corkscrew hair, and there is bleeding everywhere. Swollen gums, easy bruising, petechiae, hemarthrosis, subperiosteal and perifollicular hemorrhages, and weakened immune response. Deficiency may be precipitated by tea and toast diet. Vitamin C deficiency causes scurvy due to a collagen dehydroxylation defect, as we have discussed here. Now, excess. So nausea, vomiting, diarrhea, fatigue, calcium oxalate nephrolithiasis, excess oxalate from vitamin C metabolism. So excess vitamin C will lead to calcium oxalate nephrolithiasis. Why? Because excess oxalate from vitamin C metabolism can increase, remember, the citrate and oxalate and ascorbic acid. So ascorbic acid increase will lead to oxalate form, while citric acid will help to reduce the stone formation. So toxicity part, we have to learn about this, that toxicity will lead to increased nephrolithiasis calcium oxalate, while the citrate is protective. Can increase iron toxicity in predisposed individuals by increasing dietary iron absorption, can worsen hemochromatosis or transfusion related iron overload. So same, it will cause iron deficiency. If it is deficient, it will cause iron overload if it is in excess. So this thing about the toxicity we have to remember. Now about the vitamin D. So vitamin D has D1, T2, T3. So D3 is calcitriol, that is cholecalciferol, from exposure of skin stratum basale to sun. Ingestion of fish, milk and plants. D2 ergocalciferol, that is calcidiol, from ingestion of plants, fungi and yeast, both converted to 25 hydroxy D3, that is a storage form in the liver, and to the active form 125 hydroxy, that is dihydroxy D3 calcitriol in kidney. Now the function is increase intestinal absorption of calcium and phosphate, increase bone mineralization at low levels and increase bone resorption at high levels. These two things we have to remember. Now the regulation part. So regulation: increase parathyroid, decrease calcium and decrease phosphate will lead to increased active vitamin D3 production. We know this parathyroid hormone causes increase in vitamin D3 secretion from kidney, and that's why it will absorb more calcium from the intestine. Plus, if there is decreased calcium or decreased phosphate, both of this lead to increased 125 dihydroxy D3 production. this is the pathway that from this D2 diet and D3 from the sun. So how it will be converted? First, cholesterol will be converted into 7-dehydrocholesterol, and from ultraviolet exposure it will convert it into cholecalciferol. It will again convert it into 25 hydroxy D3 by 25 hydroxylase enzyme in the liver, and in kidney 125 hydroxy D3. Its deficiency will lead to rickets. It will cause genu varum, that is bow leg deformity, osteomalacia in children, bone pain and muscle weakness, plus pseudo fracture will be seen in osteomalacia, hypocalcemic tetany caused by malabsorption, decreased sun exposure, poor diet, chronic kidney disease, advanced liver disease. Give oral vitamin D to breastfed infants. Two vitamins that is needed in the infants are vitamin D and K. Darker skin and prematurity predisposed to deficiency. That's why Indians are mainly deficient in vitamin D. Now the excess hypocalcemia, hypercalciuria, loss of appetite seen in granulomatous disease, increased activation of vitamin D by epithelioid macrophage. Also, in sarcoidosis, I think also there will be increased vitamin D. That's why hypercalcemia will be seen. Now, vitamin E is tocopherol, tocotrienol. It is also antioxidant, protects RBC and neuronal membrane from free radical damage. That's why its deficiency will cause hemolytic anemia. Acanthocytosis, muscle weakness, demyelination of posterior column, decreased proprioception and vibration sensation, and spinocerebellar tract closely mimics Friedreich's ataxia. This is very important. Vitamin E mimics Friedreich's ataxia. Neurological presentation may appear similar to vitamin B12 deficiency, but without megaloblastic anemia, hypersegmented neutrophils, or increased serum methylmalonic acid levels. We have seen that in vitamin B12 deficiency, there is this three pathways are affected, that are posterior column, this dorsal column pathway, plus spinocerebellar tract, ataxia, plus in vitamin B12 there is also lateral cortico-spinal tract which is getting affected. So here the presentation is same. That's why they have written neurological presentation may appear similar to vitamin B12 deficiency, but all other features like megaloblastic anemia, hypersegmented neutrophils, and increased methylmalonic acid levels won't be seen here. Plus it will also mimic this Friedreich ataxia, because then also there will be ataxia will be there. Risk of enterocolitis in infant with excess of vitamin E. So excess will lead to enterocolitis in infants. High dose supplementation may alter metabolism of vitamin K dependent proteins that are factors, so enhance anticoagulant effect of warfarin. This two thing is very important, I think, every information. Now vitamin K includes phytomenadione, phylloquinone, phytonadione and menaquinone. This is K1, this is K2 and this is K3. Now the function activated by epoxide reductase to the reduced form, which is a cofactor for gamma carboxylation of glutamic acid residues on various proteins required for blood clotting, and these are 2, 7, 9 and 10. So these 4 clotting factors require this vitamin K for its activation. How activation will happen? So in this there is this glutamic acid residue. This need gamma carboxylation and it is done by this a reduced form of vitamin K and it will be reduced by this epoxide reductase. So K4 coagulation necessary for the maturation of floating factor 2, 7, 9, 10, protein C and S. Warfarin inhibit vitamin K dependent synthesis of those factor and proteins. Now the deficiency will lead to hemorrhage with increased PT and APTT both, but normal bleeding time. Can also occur after prolonged use of broad spectrum antibiotic or hepatocellular disease. Why? Because vitamin K is also synthesized by gut microbes, and if you are going to give broad spectrum antibiotics for long time, it will kill all these gut microbes, and that's why vitamin K synthesis will be hampered. Not in breast milk, that's why we give newborn this. So neonates are given vitamin K injection at birth to prevent hemorrhagic disease of the newborn. This was all about the vitamins.